Welcome to PM Express Business Edition. It looks like we had things under control. Then we woke up one morning and we saw the numbers going up. Well, I'm talking about the active cases when it comes to COVID-19 in the country. What changed? What actually is the problem? But today on PM Express Business Edition, we are looking at how this is going to impact on the broader economy and businesses that were actually picking up when things were under control. Are things going to get bad again for them? What about the banks that have given out money to these businesses? But again, how can these businesses also contribute in terms of managing the situation, not just being a government thing? Now, in terms of the numbers here, as at, I think, January 17th, the active cases now are 2,170, and this is as far back as January 17th. Now, if you bring it a little bit forward, confirmed cases, these are cases that were confirmed earlier on, and it looks like we're making some progress, about 58,822. Now, on the death, it's about 358 when it comes to COVID-19. This is as far back as January 17th or so. So it looks like when we look at now, things might actually change. Now, let's also look at one critical thing in terms of the distribution. It appears more males are getting it than compared to females. And also we understand that from the doctors, or what they are giving us, that, and as a new cases that came in that day was 391. Now, in terms of discharges, it means that out of the 58,000, these are the numbers that have been discharged. And the good thing about it is that if you report this thing quite early enough and it's managed well, it can be controlled. Now, let's look at the regional distribution. It looks like somewhere around Greater Accra, we have over 1,000. If you go to somewhere in the western side, 140. The Ashanti region also has the highest number again, and you look at the other regions, the numbers are quite. So tonight on PM Express, we're going to look at the spike in the cases and how that is going to impact on the broader economy and businesses. Businesses, for instance, those who were in the tourism space, hospitality, were just on the verge of picking up. But what happened? Did we go to sleep? Did everybody forget that there was something like COVID-19? All these things wrapped up, getting to speak to a medical doctor and some businesses as well. The Private Enterprise Federation and all those people here on PM Express. My name is George. We'll take a short break and we'll be right back. So welcome to PM Express Business Edition as we look at the spike in COVID-19 cases and the impact on businesses that are actually turning around, and also the broader economy as well. What really happened? Is it the Christmas celebrations? We all forgot that there was that animal there called COVID-19, and then things actually turned. If you see on your screens right now, as I and what is the impact of this whole thing on the broader economy as well. We'll be getting onto line to speak to the General Secretary of the Ghana Medical Association, and also be joined by an economist, Professor Sibe, also as well, to look at the impact of this on the economy, and does this actually pose a real threat to the recovery of the economy or not. To be looking at that one as well, and also for the businesses, the Ghana Medical Association as well. What do they say about it? Are they going to force to work from home, or actually we're still going to come to work? And what about those who are in the manufacturing sector as well? How are they managing the whole situation as well? We'll be getting on to Zoom, and my guest will be joining us, Dr. Yankson as well. He's the General Secretary of the Ghana Medical Association, and he is actually going to join us online to get some deeper understanding of this in terms of how we can actually get a situation under control, and also get a better understanding of all the situation as we look at it and how can we get things around. So let's try and get onto the platform right now, and then let's start with a brief discussion with some economists as well, and also try to connect. And Dr. Justice Johnson, I understand he's having some problems with the Zoom connection, and that we'll get to on him very, very soon. So let's get on. And Professor Erica Sesibe, he is an economist, and we'll start to get some understanding there. Prof, thank you so much for joining us on PM Express Business Edition. And for you, looking at it from the point of view as an economist, are you worried about what is happening, looking at how the first wave and how it impacted badly on the economy?
Good evening, George, and thank you for having me on your show. Absolutely. I'm definitely worried about what is happening now, the resurgence in the COVID-19 pandemic in our country. Seeing what the devastating effect, the health crisis, and the economic crisis that has brought to developed nations and many, many countries across the globe. I'm definitely worried that if we don't take care and we also experience the kind of resurgence and uptick that we are seeing in these countries, we are likely to derail our recovery. I mean, we all saw the devastating effects of this pandemic on the economy, everything coming to a halt. Our economic, the value chain of production actually curtailed, the businesses folded up, people were, sacked from their work, or work did not go on. So many people have to lose their job, they have to lose their income. Government revenue suffered. Government has to ramp up its expenditure on social spending, on life support, a stimulus package for businesses and others that really took us away from our fiscal targets, likely to end in the year at about 11.9%. In fact, in some other circles, it has been projected that for the year 2020, our fiscal deficit will be around 12.4 thereabout, and that is huge. It also explains why debt stock is also increasing, and currently we are around about 74% of GDP. And so if we are going to experience another height in this pandemic, you could imagine the devastating effect that will have. Even indirectly, what is happening in the developed countries like US, like Europe, which are our key development partners and export partners. If it continues as the way it is going, it is also going to have effect on our economy, because once their domestic economy ground to a halt and they are unable to produce, maintain the supply chain and the production sources and the consumption fall, definitely we're going to have impact, because it's also going to lead to our exports falling, and our projected growth will not be realized for the year 2021. And so it's a source of worry, and we can only hope that it doesn't escalate as it has started happening, that there will be a way to reducing the spread so that we can maintain the momentum, because already the recovery process is not going to be easy. We have recorded one of the lowest economic growth of about 1.2%. The disruption to the service sector, the tourism, the restaurants, and quite a number of things that have suffered as a result of this. If things don't improve as soon as possible, we will not be able to achieve most of the targets. The growth target of about 4.8 for the year will definitely not be achieved. And so it's a source of worry to every economist, and I'm sure to every development partner that are overseeing our development and our recovery from this pandemic.
Prof, I'll get back to you whether you see this as the biggest threat to the economy right now in terms of things getting out of hand. We even were crying. It was a little thing that we saw last year. But let me get back onto Zoom and bring Dr. Justice Jansen. He's the General Secretary of the Ghana Medical Association. And Doc, thank you so much for your time. It's been a long time. I don't know where you've gone into hiding. Don't tell me it's because of COVID. But Doc, if you can hear me, Doc, if you can unmute your Zoom, I'll be so grateful, Doc. It looks like we can hardly hear you. Doc, Youngson, if you can hear me, can you on Zoom, that is unmute your
Yes.
Zoom link. Can you hear me now, Doc?
I can hear you, Sammy.
It's been a long time. I don't know where you've gone into hiding. Don't tell me because of COVID.
Oh, not necessarily. We've been around trying to do what we've got to do.
So
COVID is so part of it, but we are okay.
Yeah. But Doc, from the medical perspective, and I know you always been as blunt as possible, what happened? I mean, some have blamed it on the Christmas festivities. Did we go to sleep? At one time, we're seeing the numbers around 300. All of a sudden, there's a big bump.
Yeah, I think the problem has to do with all of us, starting with the state itself. The state refused to enforce a lot of the protocols that needed to be enforced. Once we started easing sleep, unfortunately, political activity took the better of us, and we've all ended up where we are. Of course, post the electioneering period, then came the festivities, all the things that the president had admonished that we do not do, we weren't doing them. The pubs were open, the nightclubs were open, the beaches were open. There was no enforcement. We also had people coming from elsewhere who tested positive at the airport. Initially, we thought they could do some home care, but some of them, instead of being at home in isolation, ended up on the streets of Accra and other places, to the point where we had to revise that policy and get every single person who tests positive at the airport straight to a treatment center. So it's a combination of all these things that has landed us where we are now. And unfortunately, we seem to be also having or partnering with these new strains that are in the system. And we tend to see a lot more very severely ill patients than it used to be somewhere last year.
But Doc, I appreciate the bit about the government enforcement as well. But what about at the individual level? Do you think that I only use the medical association, but even you as doctors on the personal engagement and even using the mass media, you've done enough to let people appreciate the real challenge out there? Because it appears at the individual level, even people went to sleep. I have seen places where people were having pool parties around this time. And this is not 3 weeks ago, this is about 2 weeks ago. And it's like they didn't care.
Yes, I mean, you are right. I mean, beyond the state-led activities that sort of didn't happen the way it ought to have happened, the individual citizen also sort of relaxed. We went to sleep at some point, and that I think is true, except to say that, you know, under these conditions, the enforcement bits will always hold sway. People will always have the tendency to, in quotes, behave the way they want. But under such difficult circumstances, the state ought to show the way. And because there was laxity in the enforcement, I guess the individuals also took advantage of that and decided to do their own thing. And we are all paying the price at this moment.
Doc, I mean, 1 year in trying to get some sort of treatment, there's talk about vaccines and all the rest. Haven't we kept too long in trying to contain this on the medical front?
Well, I don't think so. You know, this is novel. We all didn't know exactly what was in store. It took a while for the medical community or the scientific community to get to full grasp to an extent with all that COVID itself brings along as a health problem. So once you didn't really know the extent to which the enemy actually behaved, you needed time to know the enemy properly. And then, of course, in trying to develop vaccines or cure, usually it's a very long process. What we have done at this moment has even been fast-tracked. And the various processes that, yes, vaccine development go through, we've had to, you know, fast-track a lot of them to get to where we are. if you listen to the approvals in quote that have been given, the wording is even carefully chosen. Instead of saying approval, we talk about authorization. You know, so it's like you are authorizing for emergency use. What it means is that we even still have some processes that will still go alongside what is happening now. And of course, in this business of research, it doesn't take one entity, and it also involves huge sums of money, time, and resources. And it's not every individual country that can actually go into vaccine production. So those who had the wherewithal to go into it also had to do the best they could for the rest of the world. So I think looking at it, yes, 1 year seems too long, but the truth is that the processes have actually been fast-tracked.
What can they, I mean, I was on a platform where there was talk about how the private sector can contribute in helping get the vaccines. I don't know whether I said now it's still a government-to-government thing. What can be done? I mean, I remember when this thing broke, what the private sector did in getting the hospitals and all the rest. But let me first get from you. I mean, we've tried a social distancing. There was a story about somebody who was saying that, listen, George, I stayed at home. I went out to test and I was positive. So does it appear that all these things are not working and now the best way out is to get the vaccine?
Well, I wouldn't say these things are not working. They've all been proven to provide some sort of protection or prevention, if you want it that way, except to say that whatever prevention mode that each of them gives is not 100%. And then because we are dealing with an invisible virus, in your attempt to even protect yourself, let's say with your mask, you can also end up contaminating the very mask, would say your hands or your environment, for which reason you may think that you have your mask on, but because probably you didn't wash your hands before you picked up the mask, because whilst wearing the mask, you kept, touching the mask, trying to push it in place and all that, you've actually contaminated your mask. And then you end up contaminating yourself in the process. So sometimes it is not as if these preventive guidelines we've put in place are not working, but it's just that even beyond strict adherence, there are certain, little do's and don'ts that a lot of us don't really practice well, and that can end up contaminating ourselves in the process. I think that for those who have done their best and in the process have also tested positive, this may account for some of the reasons why that situation. It is not only the mask. We talk about physical distancing, but to what extent are people really observing this? Somebody may think that when his friends or his family members come home, it means within the home setting, you don't have to put on the mask. But hey, those who have gone out and are coming in, even though you may be indoors, can also bring the virus to you. So we urge everybody to, as much as possible, stay glued to the protective measures, do their best under all circumstances to adhere to them strictly, and hopefully that will help prevent a lot more people from getting the disease than if we were not adhering to these protocols in the first place.
Doc, I'll be coming back to you, and hold on, since I want to get back to my other guest on Zoom about the role of the private sector in getting the vaccines and what else they can do. And for you, from the medical perspective as well, are you worried about, if we don't take the right steps, the real impact on the economy and on the labor front? But hold on there, let me get to and speak to the the chief executive of the Private Enterprise Federation, that is Alex Frimpong as well. And I knew that today you actually issued a statement out, actually telling your members that, listen, it is getting bad. If you can work from home, let's start it right now. From the employer's perspective again, are you worried and you think that, listen, it's about action now or never? Mr. Alex Frimpong, if you can hear me, can you unmute your Zoom?
Well, thank you, God, and good evening to your viewers. I think the association is increasingly becoming worried about the resurgence of the pandemic in the country because we all know what happened last year, especially the impact of businesses and also payments. And as we speak, many businesses are yet to fully recover. And just as the process of recovery was underway, there are 8 weeks, a resurgence which, from more intense purpose, the scientists say will be even more serious than the first one. So we have cause to worry because there's even the stimulus packages that were put in place to help businesses to be able to recover. Not many of them were able to really benefit from it. And even the quantum was not enough to help them overcome the financial burden. So to be saddled with another one is cause for concern. And we have a responsibility to ensure that members adhere to the various protocols that have been put in place so that we are able to minimize the impact on the businesses in the general employment community.
Lawyer's perspective, how are you moving away from the moral suasion to trying to compel your members? And when I started put the flyer out for this show, somebody told me, George, we are still crammed in the office despite this COVID-19. And it appears that most of your members are caught in between the bottom line and then the health of their workers. There are offices that are still crammed with the numbers. They are not working from home. They are being asked to come to work. No social distancing. And these are well-to-do companies.
Well, as I said, in the heat of the pandemic last year, many of these businesses adhered strictly to the various protocols. And the number from the Ghana Health Service at some point indicated that the spread was on the decline. So it gives some members the comfort to really put in place the measures to return to the normal business situation. But of course, with the measures to ensure that they were able to strictly adhere to all the protocols. But unfortunately, the resurgence has changed everything. I'm sure, as we speak now, a lot of businesses are recalibrating their efforts to make sure that they go back strictly to the old ways of handling the pandemic. And we have repeatedly indicated to them that there is a need for them to strictly ensure compliance. Otherwise, if we get back to the start of the pandemic in Ghana, I think that is going to be very disastrous for all of us, especially even as we talk about how the economy can fully recover from the first situation if we have not been able to, if we have not been able to really find our feet in the first instance, being saddled with another pandemic or the spread is going to be a better challenge for all of us. So I think we all have a responsibility to ensure that we fully comply. Otherwise, the consequences are going to be very disastrous for all of us.
Mr. Frimpong, I'll be coming back to you to also find out from you whether another stimulus package will be well placed or not. But let me go to somebody who is in the manufacturing sector, Mr. Sandy Osiajiman. He is chairman of Slade Industries and also the chairman of the cosmetic sector in the Association of Ghana Industries. Mr. Ajiman, for you being in the manufacturing space, I bet that this is such an uncomfortable situation for you in trying to enforce all these things they've talked about, whilst ensuring that you get the products out for us, consumers.
You want me to say something? Let me start by trying to paraphrase something that the multi-billionaire Mr. Jack Ma said in 2020 about the COVID. He said, if you're in business in 2020, your job was to stay alive. It wasn't about dreams, plans, or revenue. Your job was to stay alive. If you stayed alive in 2020, that means you were profitable. Well, why does he say that? We in manufacturing business had a very tough time in 2020, and it's extending to 2021. For example, I'll give you my personal example. In March of 2020, I ordered my raw materials from my US supplier, which I need to make my products here in Ghana. The raw material did not arrive in Ghana till November of last year, of 2020. So all the time in between, there were literal no activity. In the meantime, you have your bank loan to service, you have salaries to pay. So what do? You end up having to cut down on your staff. And we went from a peak staff of about 56 to about 20 now. And you had to do that just to stay alive. So the effect of the COVID cannot be underestimated. We continue to face the problem. And here in Ghana, for example, in other areas like the revenue collection, we don't do a good job. So the government doesn't have enough money to do the stimulus package that, say, a country like the United States will do. Why do I say that? Exports were depressed. Imports were depressed. So when you take the Ghana Revenue Authority, where they generate most of the income, that a lot of government agencies depend on, like Get Fund, like GEPA, where I chair, like NHIS, all these people revenue depressed. So the net effect is that the whole economy was down. Bankers couldn't give you any more loan because it's difficult for people to generate enough cash flow to pay. So for us in business, the solution is that you got to find ways to stay alive, and you got to find a way, if some kind of effort can be made by the government to support that actively, the long term, not just the short term support, that you get support a year and then the bank on your back to pay. It doesn't work. So I think that the government, as I see it too, has a job to do in terms of finding practical ways of increasing their internal generator fund. Their cash flow of the government has improved. And the best thing that comes into mind that I've been thinking about for a long time is that how come we don't work on property taxes to generate income for the government?
But Mr. John, sorry, just let me just cut in quickly. Apologies for that one. From what you were saying, do you think that another batch of stimulus package might be well placed, looking at what has happened? I know there are a lot of your members, maybe not you, you're doing good, I mean, who have gone for bank loans and they are struggling. And I was speaking to a managing director of a bank just last week, said that, George, some of these businesses have failed to honor the loans, and it's a big problem for us. We may have to write them off, and that is not good for us.
Yeah, well, this is very true. We're all going through that challenges, but see, the challenge with this stimulus is that some money is no good. If I need 1 million cedis and you give me, say, 100,000 cedis, what is it going to do? You might as well not have given me the money because it can't get the job done, and then you're back to square one. So I'm thinking that probably if stimulus is going to be given, it should be given in large enough sum that it can make the difference in the long term, not just Band-Aid stimulus that you get that after 3 months, 6 months, you're back to square one. Also, remember that disposable income also were down. So the market activity wasn't happening. People weren't buying because they didn't have money to buy a lot. So all that effect, the multiple effects of this COVID was that nothing was happening with the economy. As I look forward, it bothers me with what is happening these days now. Recently, the debt rate has gone up, and I don't know what we're going to do to bring it down. So this debt rate also has effect on people in business. People will have to take time out to go bury their debt, the stress. All these things are challenges that as a country we have to find a way to deal with. But I'll go back to say this since I'm on this platform. We need to find some more ways to generate income for the country, and by that effect, it can trickle down to people in business. So that's the only suggestion that I can say. If the government can generate enough business to trickle down to the economy, we in business can even be able to sell our products large enough. Positive side, though, that we now have the African Continental Free Trade Area, which is coming on stream. But even with that, the COVID is still a havoc. So how are you going to be able to say leave from Ghana to go to, say, Nigeria to market your products when we all have the same challenges? So I don't know what the answers really are, but there definitely got to be some kind of serious effort to be put into how to deal with this.
It will be a good time for me to just take a short commercial break. But when I'm back, Dr. Yankson, I'll get back to you. Professor Sibe, I'm also going to get back to you about the broader economy and for the employers as well. Going forward, you also need some stimulus package. And what is going to happen to those workers who were on waiting list to be brought back because things were stabilizing? Are they going to lose their job? We'll take a short break and I'll be back engaging Dr. Yankson, Professor Sibe, and also the other guests as well online here on PM Express Business Edition. Spike, COVID-19 cases, economy and business recovery. Welcome back to PM Express Business Edition as we look at the spike in COVID-19 cases and the impact on the economy and businesses that were just on the verge of picking up because things were stabilizing a little bit. On the Zoom, here with me the General Secretary of the Ghana Medical Association, Professor Sibe. He's an economist at Legon and also Ghana Employees Association and a businessman as well. So Sandy Osei-Ajiman, he is a chairman of Slate Industries. Let me get onto the Zoom line. Professor Sibe, let's come back to the economy because it trickles down to all of us. For you, these things, if are not managed well, the spike in cases and what happened last year, could this erode all the gains you've made and be the biggest threat to the economy?
Absolutely, yes. I mean, we have examples all over the place and using our own example too. There's no doubt that if it continues the way it is going, it's definitely going to, bring everything to a halt. And that means that I think government and the monetary authorities shouldn't rush in tightening, having this kind of fiscal consolidation or try to improve the fiscal balance as soon as they are looking at, because we have to have a worst case scenario in the event that this thing is not going to abate, is not going to go down. What is it that we can do to build resilience to ensure that the impact on the socioeconomy will not be that pronounced as we have. And so I'm beginning to look at it that I think any fiscal tightening will be premature. In a way, government should still continue to spend on, social sectors should continue to provide some form of support for businesses to be able to prepare for any form of worst case scenario. The central bank should take advantage of what is happening in the other economies where there's resurgence and really take steps to reduce the monetary policy rate so that it can have effect on the retail rate. The lending rate could then begin to also fall in a way that will provide much more affordable and long-term financing to businesses, as Mr. Sandy Osei mentioned. But
Prof, sorry to cut in.
Lining in the COVID-19, it is the fact that it affords the central bank the opportunity to pursue much more accommodative policies, given that interest rates across the globe is, around 0%, 1%, and others. It presents enormous opportunity for central bank to begin to gradually reduce interest rates so that the lending rate would also reduce. That is a much better way of providing affordable financing and long-term financing for businesses who may be reeling under difficult situation at the moment.
But Prof, from your submission, I get from you that you are a pro-stimulus, just like what other developed economies are doing. But if I could cast my mind back at the last MPC meeting, the governor warned that there is little fiscal space for government to do all these things that you're talking about.
Yes, I'm not in 100% in support of stimulus package really that is not well targeted, that is spread thinly across, all businesses. I think
so your keyword is targeted.
Strategic. It should target winners, businesses that really have both forward and backward linkage with the economy. And so that, because there's a materiality effect, if the amount involved, as Mr. Sandy mentioned, is not enough, really there's not going to be any positive impact on the business that is receiving the amount. It's just a drop, in a basket, and it's really going to bring down. And so it should be able to pick winners and have effective targeting, businesses that can support other businesses to grow, businesses that can serve as input to other businesses in the value chain, and also be able to support the economy. So be able to generate more employment, not any other businesses. Particularly with this COVID that often have the tendency of leading to travel restrictions and disrupting production lines, we have to look at businesses that, have the ability to provide goods and services to domestic consumption, because we have to begin to look at how to, increase domestic capacity. Support firms that will be able to stand in for imported product, substitute companies, so that things that we used to import in the event of disruptions, in the event that this pandemic spike and borders are going to be closed, the production, global value chain is going to be disrupted and they are no longer able to import. You should be able to support businesses that could supply the needed goods and services to support this economy. So we have to be strategic in our support, the stimulus package. It shouldn't be free for all or every other business getting it, but then very selective, picking winners and picking those that can really support the productive capacity of the economy, because the big push is important. It shouldn't spread across thinly, which often do not have much impact in the recovery process of these businesses.
Let me bring Justice Yankson, the General Secretary of the Ghana Medical Association. And at the last briefing, the President talked about if the numbers continue to go up, he might be forced to lock down. Practical solutions and first contain the situation, and using that the vaccine might be the answer. And what should the private sector also be doing right now? Businesses be doing right now?
I lost a bit of your...
My question is that for you going forward, what are the real actions that should be taken? First, containing the spread on the part of government, and also for private businesses as well. What should they be doing? Is the vaccine the answer right now? Let's get in the vaccine and just give it to people, or what?
Well, as far as the vaccines are concerned, ultimately we will need a vaccine. But between now and that period, we need to do all that we can to ensure that the impact of COVID on industry, on businesses is also mitigated. Now then, a lot will have to do on how we manage the workforce as well. Because even at the workplace, we are beginning to see a lot more infections or outbreaks of COVID at the various workplaces. And that in itself is something that will hamper productivity at the workplace. Forget about what is even happening outside of the work environment. Now, when you just suppose it into the bigger picture, where there is also pandemonium or there is also chaos outside the workplace, the market itself is not doing well. If you look at the boards are all on the downward slide and what have you, then clearly businesses are going to be in for more or less a very hard time. So what I think we need to do is to start managing our resources in such a way that, one, we are going to focus on key activity. We are also going to realign the way the workforce actually work, i.e. some working from home to remotely, let me put it that way. to mitigate the potential impact of outbreaks at the workplace. And then gradually, we can also educate the general population such that our market activity, our economic activities don't grind to a halt. Because if we don't manage to control what is happening now, then there's a tendency that all sorts of restrictions are going to come in, and that would take us probably way beyond where we actually got to as far as last year's problems were concerned. So we need to have that balance in that. And industry businesses will need to start looking from within to see how they can structure their processes to ensure that their human resources are not really impacted or negatively by COVID. And then by extension, we can deal with what is also happening within the bigger economy.
I'll come back to you for your last words on the vaccines. As I said, that what role can the private sector play in getting down the vaccines into this country, or just a government to government? And Alex Frimpong, Ghana Employees Association. So what is going to happen? I knew that, let me get to Alex Frimpong, who is the general CEO of the Private Enterprise Federation. I knew that there were some workers who were just on the verge of being called back because things had picked up, things are stabilizing. What is going to happen to them right now? They're going to go back home, they're not going to be paid, or they're going to lose their job right now?
Well, that is the dilemma that businesses face now. You would agree with me that the most important resource of any organization is the people. So to the extent that they have been trained and retrained, and they can really support the organization's business, then they are really an asset. But unfortunately, COVID has really changed everything. So those who were on the verge of getting the opportunity to go back to work, so a lot of the businesses are reorganizing themselves and also retaking the way forward, because we do not know exactly what is going to happen tomorrow. So a lot of wait-and-see attitude is really characterizing a lot of the business decisions many of these enterprises are taking. But for sure, the most important thing now is for all of us to rally together, as Dr. Yancy will say, is for us to make sure that we're able to control the pandemic. Unless and until we are all able to really contain the pandemic, it will be very difficult for all of us to ensure that these measures work. We may try to contain them, but total eradication should be the way forward. And I'm sure businesses are ready to support governments in this enterprise, because that is the only option available to us. If the pandemic continues to spread in the country and across the globe, then we all have a challenge. So for me, the most important is that we should spend our time, resources, and efforts to make sure that the pandemic is contained, if not eradicated. Then education, and most importantly, enforcement. Once we're able to combine all these, I'm sure we should be able to have some leeway to make progress. Enterprises are really suffering, and if we are not careful, it may significantly also impact the economy, and all of us will suffer for it.
But Prof,
so we're ready to work together.
But Mr. Frimpong, in just a minute on that one, the clarity is that for some of these workers, their fate is now in limbo right now, because you cannot bring them back and they have to stay home, right?
No, as somebody rightly said, if even you bring them back, if you look at the business environment now, how are you going to market your products when people are indoors?
Okay.
People are not going out of fear. For some reasons, a lot of people are not able to patronize the goods and services as they should do under normal circumstances. So that is also a limitation factor. Very
important.
We really have to be taken into account when any organization is making such decisions. So unless and until the environment improves and the pandemic is contained, it's going to be a major issue for all of us.
All right, so let me go back to Justice Youngson. In a minute, I don't have time, it's so unfortunate for me. In a minute, your final words and role that private sector can play in this whole vaccine thing. Sorry, in a minute.
Well, what it is that there is room for the private sector to play a huge role. in terms of acquisition of the vaccine, to start with, it's going to cost us some amount of money. Government is going to lead the way, but the private sector can actually help. In terms of the distribution of the vaccines, if the private sector actually partners well with government within the channels that we already have in the system, right from the point of production all the way to the source of Ghana and then distribution locally, that can actually be a place where the private sector can actually come in. Then issues relating to storage, depending on which vaccine we get, the private sector can also come in. Then the ancillary logistics that we all need when it gets to the point of vaccination. The private sector is well resourced enough at this point when it comes to COVID-related, basic items. They can also play a role in there because the logistical demands are going to be there. Government might not be able to provide all of it, and the private sector can actually come in to ensure that this is done. And then when it comes to information, sharing of information, the media house, we have a lot of private sector businesses in that area. They can also help in educating the masses or the general population very well, so that we all can put to bear some of the conspiracy theories and all that around the vaccine. So the private sector will have a huge role to play, and I think it is time we start doing that conversations properly so that we can really align that public-private partnership very well in such a way that when the vaccination bit is actually in town and we are going to start, all will be smooth for us.
Thank you.
We shouldn't wait till all is lost before we say, hey, let's bring in the private sector.
Prof, essentially 30 seconds, your final words in 30 seconds. Prof, in 30 seconds, your final words. If I can get to Mr. Sandy Osei-Agyeman in 30 seconds, your final words.
Hello. Yes. Yes. So it's obviously about ensuring that we stop the pandemic from spreading, because really, as my other speakers have said, that is the only way of forestalling any disruption to the economy. Once there's spike, there's very little that anybody can do, because it's going to affect the health system, the economic system, the social system, and all of that. So we must all put our hands on deck and then ensure that the pandemic do not spread. If government has to increase expenditure on health care, it has to ramp up its expenditure now. This is the time that is most needed to ensure that the pandemic is curtailed at all possible means. That, for me, is the only solution, other than any economic miracle that any other can do. We need to roll back the increase in the spike. Otherwise, we're going to be in trouble.
Dr. Jackson Youngson, General Secretary of the Ghana Medical Association, Mr. Andy Osei-Agyeman, he's lead industries and chairman of the Association of Ghana Industries, the cosmetic industries.
I have something to say.
10 seconds.
All right, listen. I think the government has to find some creative ways of doing this stimulus package. For example, instead of the free water and the free electricity, why the car can't be converted to cash? And the cash given to the people already paying taxes to the government. This can create a multiplier.
Thank you so much. We have to draw the curtain down here. Immense thanks to my guests out there. I appreciate so much. This has been a PM Express Business Edition. I know that the debate will still go and the talk will still go in your house. How to stop the spread.